problems. Now, I spoke about the incidence, the magnitude of fungal infection, and the most important reason we need to know about this: 60% of patients who get invasive fungal infection, that is severe fungal infection, will die. This is a bad disease, killer disease. Majority of these can be prevented with timely diagnosis and appropriate treatment. So it is not that we do not have a cure or diagnostic tools for this. And the reason for highlighting this fungal infection is majority of our clinicians are very poorly trained to recognize and manage these fungal infections. We are rather more tuned to manage bacterial infection, tuberculosis, HIV, hepatitis, but fungal infections, severe fungal infections are missed in our country. Most microbiology labs, I think my friends would agree with that, across the country, they lack even basic infrastructure and training to provide diagnostic support or monitor fungal resistance. And most antifungal drugs are very costly. The few drugs which are mostly used are very costly, are beyond the reach of most of the people. And there is no research on fungal infection in India. As I mentioned, we wanted to do CMEs, master class, workshops to encourage and assist in the publication of monographs and texts in the field of fungal infections, and carry out similar activities in collaboration. There are similar trusts, one or two trusts in the Western world, and we wanted to do the same networking in India. Now, why in Calcutta? A lot of people ask me why in Calcutta. The reason this is the first conference. And this trust is a new trust. This was developed only 2 years back. Dr. Unalok Chakraborty and myself, we thought Bengal has a very old tradition, had a tryst with fungal infection. The study of mycosis in India started with British medical officers on mycetoma in Madurai. And School of Tropical Medicine, which is still existing, in 1921, this was the first school of tropical medicine in the entire this part of the hemisphere.
The treatments are not necessarily cheap. They are sometimes very expensive. But it is treatable, provided we have the knowledge to understand what these infections are, we have the diagnostic technologies, and we are choosing the right antifungal agents at the right time and the right dose. But to enable this, we need an entire system. This conference is actually trying to establish a system like that. Already all microbiology departments in the country, be it academic or non-academic, would have some form of microbiology. But it is one thing to have it in the textbooks, another thing to have it in practice, so that patient care is improved. So we believe that through this conference, we will be able to increase our awareness about these infections and help in better understanding about their diagnosis, treatment, and